So this is the second of 3 briefings this week on the COVID-19 response. And the focus of today is managed quarantine and isolation. And we've got our Minister for COVID-19 response, Chris Hipkins, and also from the Ministry of Business, Innovation and Employment, CE Carolyn Tremaine, and also officials from MB and the New Zealand Customs Service. So what I thought I'd do is hand over to you, Minister, to introduce the team, and then we'll get underway.
Thank you, Madam Chair, and thank you again to the committee. Carolyn Tremaine should be familiar to many of you, Head of MB, and therefore Head of, by definition, Managed Isolation, but also working on our COVID-19 response around some of the things that we're doing around essential movement and essential services as well. Rose King and Megan Main from MIQ, and Christine Stevenson, who in addition to being the Chief Executive, pardon me, I've been doing a lot of talking today, in addition to being the Chief Executive of Customs, is also the chair of the border executive team, so looking across the border at the different arrangements that we've got in place there, so particularly pertinent in light of our COVID-19 response. So we're happy to get straight into questions.
Okay, thank you. So just first question to Chris Bishop.
Oh, thanks. Oh, yeah, you can hear me? Good. Sorry, first question, just as a follow-up from the 1 p.m. Minister, how many, 20,000 total contacts, how many of those are close plus contacts?
Sorry, I don't have that number with me right now. I was
just highlighting, Chris, where the focus today is MB, so the Minister may be able to answer some high-level questions, but anything about the health response.
Sorry, Madam Chair, he's literally just done the 1 o'clock presser, so you know.
Yeah, just pointing out, we'll do some high-level questions, but the focus today is MB, so we may not have the correct officials here. But over to Minister Hipkins.
Yeah, sorry, I literally just don't have that relevant piece of paper in front of me. I know Dr. Bloomfield gave it out at the press conference, but I just, sorry, preparing for this meeting, preparing to talk about a different set of topics, I just didn't bring that particular set of papers with me.
Okay, can I take it from that you don't want to talk about the Highbrook vaccine issue? Is that outside the scope, or are you happy to answer questions on that?
I'm happy to make a quick observation, some quick observations on that, given that we've just talked about it, yeah.
Okay, so just some very high-level questions, then we can move on to MIQ.
Well, so I'll decide how I ask the questions, thanks, Madam Chair. So, Minister, are you satisfied with the situation with the Highbrook vaccine possible error?
Well, I don't think anyone would be satisfied with it, but overall I have confidence in the team and in the system. I think it is regrettable. At this point, it is impossible to conclude whether in fact this was a data error and simply that things weren't recorded appropriately, or whether there is a real risk that potentially 5 people got a vaccine that was either diluted or didn't have the active vaccine component in it.
So when did the investigation start into whether or not the people have been vaccinated properly or not?
That would have been, my understanding is it was picked up at the end of the day. So when they did their final count out at the end of the day, it was picked up and the investigation started straight away thereafter.
So why are we only finding out about the investigation now, 44 days after it started?
Well, as Dr. Bloomfield, I think, indicated at the press conference today, there was some discussion and some question about whether, in fact, there was an issue here, and that was one of the things that they were investigating.
When did you find out about it?
I found out about it a few weeks back. I don't have the exact date about that, but we were notified that there was a potential issue and that it was being investigated.
You found out a few weeks ago?
From memory, that's correct, yeah.
How did you find out?
I believe it was in just the regular vaccine reporting that it was indicated that there could be an issue.
Do you know when the Ministry of Health found out about it?
No, sorry, I don't.
Okay, we might want to get back into that with Mr. Bloomfield. But I suppose the question that a lot of people will be asking is, how do we not know after 44 days whether or not vaccines have been administered correctly or not?
Well, one of the issues is, it's very difficult to know for certain because there's no way of checking. So whether someone got a diluted vaccine or a saline solution, so saline solution is what's used to dilute the vaccine in order to administer it. There's no way to know for certain. And it's quite possible that this is a sort of a counting error rather than an administration of the vaccine era.
So what's going to happen now? Wouldn't the simplest thing be to do to just make sure every one of the 732 people who were vaccinated that day goes and gets a serology test to make sure that they're developing an immune response, and if they're not, then 5 people, can get another dose?
Well, that's ultimately a decision for the public health clinicians and for the immunologists to make.
Okay, can I ask about the Crowne Plaza, which is relevant to MIQ? Have you seen the photos of the 2 public walkways at the Crowne Plaza?
I'm aware of. I haven't seen photos, but I'm certainly aware of the description of the situation there. Yeah.
Do you think? I'm surprised you haven't seen the photos, to be honest. But are you comfortable, or do you think the setup of the 2 walkways is adequate?
Well, certainly one of them. There's been some further remediation work there to extend the barrier that's in place right up to the ceiling. I would note that the Crowne Plaza has been the subject of several infection prevention and control audits, and that the issues around these particular walkways were not raised in any of them. So it's not just one audit, there have been multiple audits, and no concerns were raised about that by the people who have expertise in this area.
Well, isn't the fact that just they've moved as a matter of priority to change the wall or the perspex, so to speak, isn't that an admission that there are issues?
Well, it certainly provides a greater level of reassurance to people.
Okay, so when was the last infection control audit conducted on the Crowne Plaza?
I'll invite one of our MB team to answer that.
So, Mr Bishop, that was on June 2021. We've had 4 audits from December, March and June, and there was another scheduled for September.
And did the June 2021 audit raise any issues around the setup of the public areas around the Crowne Plaza?
No, it didn't.
Okay, do you find, in light of what's happened subsequently on the Delta variant, do you find that surprising?
No, I suppose at this stage we are still conducting the source investigation. We're supporting the health team who do that work, and at this stage, whilst it's a remediation action that we've all agreed should be done to take the perspex barrier to the ceiling, we as yet don't have any definitive outcomes from that source investigation.
What is happening in relation to the number of people who may have passed by the exercise area while the family who tested positive exercised on, I think it's the 12th of August? What work is being undertaken to find out how many people passed by the exercise area in that little period of time and where they are?
I might hand over to Brigadier King to answer that particularly, but just note that in our exercise areas we do have a distancing issue from the fencing that people can go to. But Rose, perhaps you can answer the member's question.
Thank you. We are working continuously with the public health in Auckland in regard to the investigation and providing them all of the information that they require for that, as outlined by my CE. The walkway area itself does meet all of the requirements in regard to protocols in regard to fencing. So there is 2 layers of fencing. Both of those are a minimum of 2 metres apart, and that is in line with the health recommendations. So from our perspective, they have met those requirements. When
were those health recommendations or guidance, when were they last updated?
I'm sorry, I don't have that in front of me. The public health, where we go to in regard to reviews, but as mentioned, the last review we had on that facility was in June.
Would you be able to go back and have a look for the committee? The reason I ask that is that obviously with Delta in the last few months, public health guidance, from last year potentially is out of date in light of the new variants. We've seen Delta spread just from people across the corridor with each other opening the door for a few seconds. So the reason I ask that is that the guidance for exercise facilities last year may not be relevant for exercise facilities in the present day, and I'd be interested to know as to when that guidance was last updated and when it's been followed. So would you be able to go away and check that for us?
Definitely.
Okay, thank you. I think, Madam Chair, I've had a good run, so
okay.
I'll hand it over, but I'm happy to come back as well.
Yep, thank you. Okay, so across to Brooke Van Velden, and then also following that, Debbie Nawuwa-Peka.
Oh, thank you, Chair. Firstly, I'd like to pick up where Chris Bishop left off, because I've also got questions about the saline solution that happened at Highbrook. And just following on a few of your answers,
Can we just make sure that we keep the scope focused on MIQ, maybe 1 or 2 questions, but then moving on to the MIQ focus? Thanks.
I'll just ask a few questions. Thank you. Do you know of any other vaccine centres where this may have happened? Have you been made aware of that at any other place?
I'd have to come back to you on that. I'd have to get I haven't got the relevant team to talk about vaccines with me today. I believe that there has been one other incident where people were called back for a vaccine, where it was clear what had happened, but I don't have the details of that.
If the story hadn't have been made public today, is there the possibility that those people who may not have received a vaccine would not have known? Because it appears from the press conference at 1 o'clock that Dr. Bloomfield talked about people being contacted over these next 24 hours about whether or not they could have been, given a saline solution by mistake. Do you expect that the Ministry of Health should be more open and transparent with people when they could make a mistake?
I think the time delay in making the information public is regrettable. I think it would have been better if they had been more upfront sooner after this happened. Overall, I think, as Dr. Bloomfield indicated at the press conference today, they did intend to get in touch with people to let them know what had happened. They did intend for this information to be made public. I think it would have been better if that had happened earlier, but he also indicated that there was still some disagreement, if you like, as to what the most likely thing to have happened here would have been.
Do you believe, following what's been happening, that we do actually have good, adequate systems in place so that this doesn't happen again at another vaccine centre?
You can never guard completely against human error in the health system. And these things do happen in the health system, and they are reported when they happen, and they are investigated. And no system can ever be 100% foolproof against human error. So I can't here, hand on heart, say that any more than I could say that for any other aspect of the health system. And I think it would be unreasonable to do that. What I would note, though, is that our vaccine rollout has been incredibly safe and efficient. Our utilisation rates of the vaccine doses sits at about 99.5%, when the World Health Organization basically would argue that anything above, they say to plan for a 10% vaccine wastage rate, and we've got less than 0.5% vaccine wastage rates. So, in terms of the incident reporting, outside of reactions to the vaccine, which are all thoroughly reported and investigated, we have very, very few. And so that's a sign that the vaccine is being rolled out very safely.
I'll move on to my questions. So I've been contacted by somebody who was told on the 18th of August, which is the day after we went into level 4 lockdown, who was travelling from Sydney to New Zealand, that they were told that they did not need a pre-departure test. Was everyone who came in from Sydney, once the travel bubble was shut, told that they did not need a pre-departure test?
I will ask Christine Stevenson to answer that, because we did have some different requirements for New South Wales earlier on compared to what we were doing for other Australian states, based on availability of testing and practicality of getting tests, and a concern that getting a test could potentially at one point in the process have put a person more at risk than not having a test. And given that we were putting them into 14 days of managed isolation on return, we did agree to a different requirement for New South Wales during some of the early phase of that response. But in terms of recent advice, I'll ask Christine whether she's got a comment on that.
Thank you. The Minister's quite right. We have had variable advice over time, and I would have to check for the member what the posture was at that date.
Okay. My follow-up to that is that the official guidance on the website currently still says that if you're coming from New South Wales, you do not require a pre-departure test if you're coming into MIQ. Is that still accurate?
I can check the order, but my understanding, from memory, yes, that it would still be correct. And again, one of the things that we look to there is the potential for people to be more likely to be exposed to COVID-19 in the process of getting a test. And that is something that we do think about in the New South Wales context.
Isn't this also, though, a safety concern for MIQ, because we don't know who we're bringing in potentially with Delta variants from New South Wales, when we know at the same time that we're having breaches within MIQ, people picking up Delta within the same facility?
That's one of the reasons why we have now the day zero or on arrival testing, because it does help to reduce down that risk. That risk applies to anyone coming from anywhere in the world. Even with a pre-departure test, it's still not a guarantee that someone isn't going to come in with COVID-19, because they can contract COVID-19 in the 72-hour period before they leave after they've had their test. They could have picked it up the day before they had their test and it might not necessarily show up on the test, or they could pick it up in transit. And so the day zero test, again, is another layer of filtering. We've increased the frequency of testing in MIQ. So we've got a day zero test, a day 3 test, rolling out a day 6 test. Again, these all help us to manage that risk as much as we possibly can.
So I know that there are approximately 11,000 MIQ spots still available for the remainder of the year, but we know that under level 4 MIQ booking has been put on hold. What work has been done? Because I understand part of that reason was because we don't know what the domestic demand might be for isolation, for example. But what work has been done over these past few months in the likelihood that we were to get a Delta outbreak to make sure that we had sufficient capacity?
It is one of the things that we're constantly looking at. The way we manage bookings, we don't release all of the vouchers for a month at a particular time. We stagger the release of vouchers so that we always have some ability to flex in the system, and you're seeing the ability to flex in the way we're working at the moment, including the fact that we have a contingency in place in the next few days in the event that the jet park ends up being full, that we can convert another one of our managed isolation facilities into an additional quarantine within a couple of days. And having that flex in the system is something that we aim to be able to do. So the system was working exactly as intended with regard to that. And you know, we're always looking for how we can best utilise the facilities, because I don't want them sitting empty either when we've got queues of people wanting to come home. So there's always a difficult balance that we're always trying to strike here.
From information that we received in an OIA around February, we are of the understanding that there are about 55 hotels around New Zealand that could be used for an MIQ facility. They meet that standard. Have you reached out to any of those facilities to see whether they could, in fact, be brought about now, or have you reached out to them in previous months to make sure that we do have this capacity for a Delta outbreak, to make sure that we do have that domestic capacity?
It's important to note that the physical hotel availability and capacity is not the only part of the equation. We've also got to look at workforce. So which district health boards have workforce that could be allocated to servicing their health needs in an MIQ facility, and where can we source security, for example, and all of the other workforce that we need in order to run a facility like that. We are in the process, as I think has been canvassed in the media now, of exploring the potential of converting a couple of additional hotels into MIQ facilities. There's some community reaction to that in some parts of the country, as you will see, most notably in Rotorua, where there has been some comment on that. And so we continue to look at how we can get more capacity into the system. It isn't just a question of hotel availability. The other part of the puzzle is assuming you can stand up a facility with all the requirements you need there, there's then a logistical question of how you get people in and out of that facility. one of the challenges we have with our Wellington facilities is that they do require an air transfer or an air bridge from either Auckland or Christchurch in order to put people into the Wellington facilities. And when you're dealing with an arrival pattern for passengers that can be quite unpredictable, that can be very challenging. So if we have a charter flight booked, for example, from Auckland to Wellington to transfer 40 arriving passengers from Auckland into the Wellington facility, and only half a dozen of them actually arrive at the airport, and this is not an uncommon occurrence, people, we get no-shows all of the time, then that flight gets cancelled. Those people get absorbed into the contingency in Auckland because it's not viable to run a charter flight to transfer them at that point. And then you end up with an underutilised facility in Wellington. So that is one of the logistical things that the team are constantly working to do. So it's not, so there's the how do you get them to and from the facility, how do you staff the facility, how do you make sure you've got a facility that's safe, and bearing in mind too that ventilation assessments and all of that take some time to do. So there's a lot to that question, but I guess the overall answer to your question is yes, we are looking at whether we can get more, squeeze more out of the system by putting more capacity into it.
We'll just move on. We need to move on. Sorry for timing, just because we've got other members waiting. But thanks, Brooke. Just moving on to Debbie and then Julianne.
Kia ora, thank you, Chair. Just want to pick up on systems and capacity before I get into some of my questions as well, Minister. With the increase of unprecedented increase of contacts and this mode into self-isolation until MIQs are available or they are transferred to MIQs, who is managing and monitoring those in isolation in communities, and how is compliance and welfare well-being being monitored, and how many does this currently involve?
So the public health teams do a series of kind of triaging, if you like, of potential contacts, cases, etc. So someone who's tested positive for COVID-19, of course, is our highest priority for isolation. We get them into quarantine as quickly as we can because they're the greatest risk. People who are close, very close contacts, who cannot isolate, effectively in their usual home because because either it's not appropriate or they're in contact with others. Yes, we do want to try and support them to isolate safely. And we have got one of our facilities at the moment available to support people who are in that position. The healthline teams and the call centres, the contact tracing teams, there's a bit of interaction between those two in terms of sharing workload and so on, are making outbound calls to people to check on their welfare, to check on their isolation. What we're finding is that those outbound calls are finding people are very compliant, so they are where they should be. They're not out there if they've been identified and asked to stay home, they're staying home. So we're seeing really good compliance with that.
Minister, is there sight within the communities with the local DHBs, given we looked at the heat map and it shows that there is an enormous amount of contacts going, spread throughout the country. Is there sight within the local authorities, the DHBs, the health providers, of what's going on around them?
Not really sure what your question there is.
I guess for the welfare, the well-being and the compliance aspect, I would imagine that that's got someone around in the community that's got some contact with them, getting groceries. Is there a connect with those in those situations with the community services around them?
I'm with you, yeah. Look, we do have quite good networks, and our contact tracing system does reach out where it needs to ensure that people are getting the support that they need. So if someone in the welfare checks that are being done, if they identify, for example, I can't go out to the shops and I've got no one else who could do my shopping, then we would endeavour to facilitate putting someone in touch who's able to support them in that.
Is that done through the MOH, the social services, or is that done through the local DHBs?
It'll depend on the arrangements in place locally. A lot of work went in over the last year and a half between when we did this the first time and now to look at those things like food parcels and the best way of making sure that people are getting food parcels, and not just from a contact tracing perspective as well, but also for needy people in the community who are unable to do their own shopping without support and things like that.
Debbie, I'm coming back to scope. Are we able to focus more on MIQ?
Yes, sure. I was just going to go into that. Why does the government continue to increase MIQ placements in working class Māori communities and PI communities like South Auckland, rural Māori communities like Rotorua, when you have acknowledged that Māori are one of the most at-risk vulnerable populations? And I guess specifically with Rotorua, will you listen to what it is that the leaders in Waiariki are asking in respect to the MIQ facilities?
So one of the, in answer to the latter part of that question, one of the big bits of feedback we're getting from local community leaders, and I've been speaking to them personally, and as have the team who have been doing consultation there, that some of their concerns relate not just to MIQ but to wider situation, particularly around emergency housing and homelessness. And so the government is working with them on those issues. We acknowledge the concern there. The facilities that we're using for MIQ purposes aren't the sort of facilities that we would use for emergency housing, but we certainly understand the concern that's being raised there. In terms of South Auckland, we have reached pretty much capacity in South Auckland, even if there were additional physical facilities available in terms of our workforce. It would simply stretch that system too much, so we're not looking at any further expansion there. Rotorua is an area where we do believe that we can get a bit more capacity out of our workforce there, and so that's the reason that we're looking to that. In terms of the demographics of the communities around where our MIQ facilities are, that is actually just a reflection of where hotels are, and the hotels are that we're using them.
Do we have an idea of what number of Māori and PI staff we have working in MIQs?
And we do have that breakdown because it's in the regular testing data. So I might ask the MIQ team to comment on that.
Rose, are you able to answer that? I don't have those breakdowns of the workforce. Do you have them at all?
Thank you. No, apologies. I don't have that in front of me, but I can get those and bring them back.
We'll certainly send a copy into the committee.
Thank you.
Appreciate it. I think a couple more things. I guess we've seen some breaches in the Tauranga and Taranaki port, and would be interested to hear what changes have been actioned in respect to preventing any more COVID infections or risks at our ports. Are you able to update us, please?
When we talk about breaches, I think it's important that we note that what we're talking about is risk management rather than necessarily breaches. So yes, a ship coming into port with COVID-19 positive cases on it gives us a greater degree of risk that we have to manage. And the system is geared up to be able to manage that risk. And we've seen that with recent ships who have come through with COVID positive cases on them, where we've very successfully managed a response to support those ships getting access to testing, getting access to whatever it is that they need. But again, and we constantly are looking at how we can switch that up and improve it. So, for example, just a couple of quick examples. Vaccination clearly is an area where we've got a real focus on getting vaccination rates up amongst our port workers. But the ports themselves have been making changes. So in terms of the proportion of their workforces that go on to ships that are coming in, they're very cautious there. So they've made operational changes to reduce the number of people who might be at risk and who might be coming on to ships and so on. So Christine Stevenson might want to add to that.
Thank you, Minister. I think it's really important to remember that we owe a great debt to the port workers, both public and private sector employees who have managed to support shipping to keep our essential supply chains going. And I think they've done that very successfully. Port workers have been wearing PPE for a year and a half now, and for the most part very diligently. As the Minister said, the majority of port workers are now vaccinated. The proportion who are not vaccinated at this point is very small and is reducing. And as you may be aware, from tomorrow, the remaining government workers at particular locations like ports must be doubly vaccinated or must be vaccinated, and the private sector comes into play on the 30th of September. As the Minister said, we're constantly looking at improvements we can make. I think these recent vessels have been handled, again, very successfully. I think the teams have done a great job, and our relationships between certainly my customs team who implement and lead the Maritime border order with ports, with the maritime unions, they're very strong relationships and things have worked pretty smoothly. That's not to say we can't do better. we have started to look at whether we can work with the shipping companies and actually with other countries to see whether we can't get incoming overseas crew members vaccinated. That's very tricky. As you can imagine, if you're on a vessel, you're probably living on it, you're going from port to port. So getting doubly vaccinated is hard, but that's not to say we shouldn't look at it, and we are. There are other things we've put in place when we have crew transfers. Currently, crew can't come through. Often they have to spend a night or two in a managed isolation facility as they await the arrival of their vessel. They are tested for COVID, but up until recently they have been able to leave without necessarily getting the test results. That's going to change. So, that's just one example of the sorts of things we're doing to further strengthen the system. Thank you.
Thanks, Christine.
Finally,
and
after 18
Debbie,
months, Minister, I just wondered, has more not been done to secure our permanent state-owned managed isolation facilities?
Debbie,
and I
just
guess are you moving down that path? Sorry.
Debbie, just noting, sorry, we are at time. I do need to move on to other members.
I would just like to finish this one other because, this is the only time we get to do this discussion.
Okay, one very quick question, but we do need to move on. Just quickly.
Thank you. Just, Minister, after 18 months, why has more not been done to secure permanent state-owned managed isolation? Clearly, this taniwha is not going away. Then we can enable a stronger health protection, security and efficiency. What's your view there?
Look, we continue to look at what the best arrangements at MIQ in the future are. In terms of standing up the scale and the capacity of MIQ that we have at the moment, using hotels was by far the fastest and the cheapest way of doing that at short notice. And it has served us very, very well. I just want to remind everyone of the sorts of numbers we're talking about here. 160,000 new people have come through our MIQ facilities, more than since we started operating them. We've had I think it's over 1,000 now positive people come through those facilities. And the scale of breach, if you like, that we're talking about here, you could count on your hands. It is a very successful operation in terms of keeping COVID-19 out of our community. We look all the time at what the future makeup of that might be. There are a variety of options on the table. Continuing to use hotels in the current arrangements that we have, which are sort of a serviced lease or serviced contract type arrangement with the hotels, is likely to still be part of the system over the longer term, depending on how long we're doing this for. But there are two other aspects that we continue to explore, or three other aspects we continue to explore. Purpose-built facilities that are built and operated by government, purpose-built facilities that are built and operated by someone else, or potentially purchased facilities that are then a greater degree of conversion work is done on them. So all of those continue to be on the table. There's nothing quick that can be done in this space though. Even as you see now, just trying to stand up a few extra facilities to expand our capacity is not without bumps in the road.
Thanks. Okay, Julianne Genter and then Sarah Pallett, followed by Dr. Shane Rutty.
Kia ora, Minister. I have a series of questions about MIQ, and I appreciate the answers you gave earlier to Ms. Van Velden about the difficulties with logistics and trying to increase capacity. But I really just want to understand if anything is being done to try and respond to the increased demand that was happening, especially given that at this time there's going to be a reduction in the MIQ rooms available to ensure that New Zealanders overseas are actually able to come home if they need to.
Certainly we're looking at whether we can, get some additional rooms, some additional facilities coming on stream to expand our overall capacity. That's something that we are working on at the moment, and you'll see that we're out there doing some consultation with communities and the like, and I've touched on some of the feedback that we've already had from what we've been doing so far there, and we'll keep doing that work. We're looking, and we can speak more about this if you want to, around just how we make the process more transparent and fair for people. Having said that, no matter how you do the booking process, when you've got a lot more people wanting to come in than you've got space for, there are going to be some people who miss out. And so that's going to continue to be a challenge for us. We're looking, and we'll make just in the process of making some further changes to the emergency allocation criteria to make sure that we're genuinely providing that short notice emergency allocation for those who really, really need it. and we're constantly looking at that criteria just to make sure it's operating as intended. I've just signed out some further changes. I think we should have those ready to go tomorrow, which we should be able to talk about those tomorrow. So always looking at that system, very, very aware though that high demand, limited capacity is still the big issue.
So RNZ is reporting numbers that...
Julie, you've just gone on to mute. Would you mind unmuting yourself?
Sorry. RNZ has reported that in February and March there were, between 6,000 and 7,500 rooms filled by the general public booked through MIQ, and that by July that was down to less than 5,000 at the time that demand was increasing. That seems like a pretty considerable drop in availability as well as an increase in demand, like a 40% reduction in rooms available. Is there any chance of that being sorted, like of increasing the number of rooms available while keeping it safe?
So a couple of observations on that. The first is that we did have a period in the sort of the second quarter of the year, if you like, where demand was well and truly less than supply. So we did have rooms sitting empty. There were vouchers available. People could get them at short notice, and the facility wasn't completely full. We tried to use that time as much as possible to do some of the maintenance work that was required. That did reduce our overall operating capacity at the time that work was taking place, because some of the maintenance work is difficult to do when you've got people isolating in those facilities. So you really want to empty them out so that people can get in there and have a good poke around, do whatever work is required to be done. And we tried to reschedule some of that, bring it forward so that it was happening in that period where the demand was lower. But there were still vouchers available during that time. Another thing that impacted on our overall capacity is that we did take 500 rooms out of the general circulation for the Trans-Tasman contingency, knowing that opening up Trans-Tasman contingency, the Trans-Tasman travel bubble was going to result in thousands of people flooding across the ditch, which is exactly what happened. And then we've been using that to provide a pathway for people to come back, particularly from New South Wales, but also, just making sure that we've got that contingency there. Also, the ability to respond to anything in, say, the Cook Islands, or as we explore our arrangements with the other Pacific countries that we're talking to, Tonga, Samoa and Vanuatu, that we have some capacity to respond there as well. And then you've still got the issue of where facilities are offline because they have to have essential work done on them. Ventilation system upgrades is a really good example. Some of the ventilation work, the minor tweaks can be done while people are there, but actually some of that ventilation work requires us to really empty out a facility while they pull all the ventilation apart. So that will take some of those rooms offline during that time. So that's a combination of all of those things. But the system is right now operating at capacity and has been over the last little while since the Trans-Tasman bubble popped. And it's some of the transparency around that hasn't been as good as it should have been, and I'll own that, where the system might have been reporting vouchers that were, or occupancy based on vouchers, and it wasn't also including people we were accommodating through Trans-Tasman contingency and so on.
I guess many of us will have been getting a large amount of correspondence, as no doubt you have, of really harrowing tales of people who are stranded overseas. Maybe they don't have access to benefits. They're in countries that have worse COVID outbreaks than New Zealand. Their work visas are terminating and it's just impossible for them to get back to New Zealand. I guess my question is, like, how big of a priority do you see it for the government? How big a responsibility is it for the government to ensure that New Zealand citizens and residents are able to return?
Look, I do get a huge amount of correspondence on that. I don't think it will come as a surprise to anybody that there is that demand there. It's fair to say too that there's a high degree of variability in people's circumstances and reasons for wanting to travel. I signed out a response to someone just a few days ago where they, having arrived in the country in May, were outraged that they could not return to the United Kingdom within the next few months for somebody's 50th birthday and be guaranteed a spot coming back. Now, that's the sort of spectrum. So you get people who have an absolute need to come back, through to people who want to be able to continue to travel as normal and expect there to be an on-demand MIQ system for them when they return. And that is one of the challenges that we have here.
Okay, thank you, Julianne. Across to Sarah Pallett and then Shane Retty.
Thank you, Madam Chair, and thank you, Minister and officials, for being here to answer questions. Much appreciated. I would just question slightly the positioning of MIQ. Ireland is fortunate to have all but 2 of the MIQ facilities in Christchurch, and we're incredibly proud of them, and we're really grateful to all of the people who work there. But my question is really about Delta and its transmissibility. So I know that Delta virus is, the Delta variant is actually much more transmissible than we'd previously seen with COVID-19. We saw that with the facility where an individual actually was infected as a result of two doors being opened across the corridor at the same time, and that was at Jet Park, I believe. And I just wondered what changes have taken place at the Jet Park facility, if any, since then. And if you could describe them to me, that would be great. Thank you.
So I'll get the team to talk about the work that they've done to shift up the operating practices in response to particularly that issue around doors opening one after the other or at the same time, and the work that they've been doing to shift systems around to avoid that sort of thing happening. I do just want to pick up the sentiment at the beginning of your comment before I hand over to them to do that, though, that we are all indebted to the people who work in our MIQ facilities. And I also just really want to reiterate the fact that whenever there's something like this situation that we're dealing with at the moment, whenever that comes up, they really feel that pressure. There are people who are working in MIQ who are ostracised from their communities. You know, they're not welcomed at sports clubs and all of that. They're really made to feel quite bad because of the work that they do. And yet I believe quite passionately that these are our national heroes. And that without them doing what they are doing, we would be in a much, much worse position than we are now. So I just wanted to put that on record in this environment because, you know, I know how hard they try and I know how hard that they are working and I know how personally they take any criticism, even if it's not directed at them. So, but perhaps if I could hand over to our MIQ team.
Thank you.
Rose, you're probably best positioned to talk about some of the changes with Delta.
Kia ora. In regards to that specific example that you give, whenever there is an incident like that, we work hand in glove with our health colleagues in regard to conducting investigations, and we certainly have a mind of continuously learning and reviewing our processes. In regard to that specific example, that has been reviewed in regard to the opening of doors, and we do have a process where we look to alternate timings of when food, for example, is delivered to rooms. However, I have to note that unfortunately you can't monitor human behaviour, so no matter how much we try to alternate timings and that, when someone chooses to open their door, we can't control that. But we certainly take all possible steps in regard to how we reduce the risk to people within the facilities.
Thank you. I appreciate it. And thank you, Minister, for your kind words. It's really appreciated. Can I just follow up on that and just ask if any changes have been rolled out across the country through different facilities, obviously addressing the incident in Jet Park?
Rose, could I hand that to you as well?
Sure, Minister. Yes, so whenever we have one of those reviews, like I just said, we always then look at that with a view across the whole of our system, so not just the one facility, but across all of the systems. And that example that I've just spoken to you about was one of the things that we have looked at in regard to our standard operating procedures and how we ensure that that is now the case across all of the facilities.
Great, thank you, Rose. Okay, across to Dr. Shane Retty and then Simon Watts after that.
Thank you, Minister. Can I first just raise a point of clarification from an answer you gave yesterday? And I was making the point that the pharmacy girl told me there are 400 pharmacies in metropolitan Auckland and only 12 of them are approved to vaccinate. And you said that the cold chain was a challenge or had been a challenge with 5-day storage. That was the 28th of May. That was changed to the 32 days we have now. That's 3 months ago. Again, I come back. Why can we only have, or how do we explain 12 pharmacies in Auckland vaccinating, and can you commit that by the end of this week, all 400 will be able to vaccinate?
I certainly can't commit that that would happen by the end of this week, no. The team are working very hard with the team of health are working very hard to bring on board more primary care locations as quickly as they can. One of the things that they'll be looking for there is to ensure geographical spread as much as they can. We do expect primary care are going to be in the system in much greater numbers within the next couple of months. But it takes, they've halved the amount of time it takes to bring them on board in terms of the onboarding process. But they're really looking, you know, in the early part of rolling out the vaccine, they were looking for those sites that could do the largest numbers first. And that tended to be, you know, bigger primary care facilities and, of course, the bigger community-based vaccination clinics. As we get to the point where we have a much greater supply and we're doing a much greater number of vaccines on a daily basis, 80,000 vaccines done yesterday, which is a phenomenal rate. It puts us amongst the highest countries in the world on a per capita per day basis. Then you know, we do have the ability to bring more different vaccination sites on board.
If I've heard you correctly, and if you're saying it may be months to bring GPs and primary care on board, that's a failure. It's a failure, I'm afraid, and maybe part of the failure is what the specialists and the GPs clinics are telling us, that part of the approval process is that they have to demonstrate evidence of entry and exit, that is, send photos of entry and exit signs. I would suggest we've got bigger problems if we want GPs and primary care to vaccinate than sending in photos of entry and exit signs.
Actually, infection and prevention control in a vaccination site is vitally important. The last thing that we want is people going to get vaccinated and finding that the act of leaving their home in a level 4 environment to go to get vaccinated results in them becoming exposed to COVID-19 because that is the last thing anyone would want. So making sure that every site that we are using at a level 4 environment to do vaccinations is set up in a way that preserves all of the distancing requirements that we need, and that includes looking at entry and exit points from those sites. I would argue that that is actually very important.
Well, I'd argue that if we trust general practice who have already been doing vaccinations, then we should trust them to do this and bring them on board quicker. But I want to come to the jet park. It's been reported that coronavirus positive people are waiting for at least 24 hours or more to access our premier quarantine facility in Auckland. Does that have substance? Are there people who are coronavirus positive who are waiting to enter the jet park? Do you have any sense of how many that might entail, how long they could be waiting, and what the hurdle actually is?
It's not necessarily a constraint at the quarantine end. We do have rooms available as of now for people coming in from the community, but there can be reasons why there can be a delay between when somebody is identified as needing to go into the jet park and when they actually arrive there. But I'll get the team to comment on that. But it's not, it wouldn't necessarily be right to say that that's an MIQ issue. Sometimes there are additional public health reasons why it can take a period of time between when someone's identified as needing to quarantine and when they actually make it to quarantine.
And often this can be relating to transport availability as well. But Rose, do you want to address the issue specifically about wait times in the jet park?
Yes, so I'll just reconfirm that there is availability at this point in time in the jet park to receive people coming in from the community, and we are working closely with our health colleagues in regard to ensuring the people that need to come into our facilities can. I'd just like to reiterate that these are a number of procedures and IPC control measures that we need to take both with the people who are doing the transportation park and moving the people in to make sure that we're keeping not only the individual who is coming to our facility safe, but those who are transporting them and also the wider New Zealand public. We have increased the number of transport capabilities we have to address this issue, but obviously at the moment the demand we have is higher than we have had previously, but we are working closely with health to address this and work through it as best as we can.
Can I ask then, as my last question, are any one of the astroviral metrics, MIQ-related astroviral metrics, being successfully achieved? So at least half of them are MIQ-related. On your monitoring to date, is there any single one that's being successfully achieved?
I'm sorry.
Minister Hipkins, would you like to answer or direct to one of the officials?
No, look, I'll direct to the team, but I do just want to point out to Dr. Etty, I think as we had this conversation yesterday, we do have to keep in mind that those metrics were designed in a pre-Delta world, and Dr. Verrill herself has indicated that many of those metrics will be very, very difficult to reach in the context of the Delta virus, which is spreading so much faster than previous variants of the virus were. But in terms of the individual measures relating to MIQ and where they stand as of today, I'll hand over to the team to comment on that.
I think unless Megan or Rose, you have that information with you, I think we'd be able to come back in writing to the committee.
That'd be appreciated.
Thank you.
Okay, across to Simon Watts and then Chris Bishop.
Thank you, Chair. Kiwis are reporting wait times of up to a week for COVID test results to be returned, some of which are close contacts from the Crowne Plaza MIQ, which is obviously causing frustration. What is the longest wait time between the COVID test being taken and the person being informed of the result?
It's not, I guess there's two parts to that question. One is how long does it take to process the result? So how long?
Just simply the longest wait time between someone getting a test and then being told the result.
Well, it depends on who's doing the notification of the result. In some cases, the result gets reported back to their primary care practice, and then it's then up to their primary care practice to report the result back to them. And I can't give you an absolute guarantee that people are getting those results back from their primary care practice in a timely manner. It would depend on the systems that those practices have in place. Having said that, if someone gets a positive test result, they'll know about it really quickly.
Minister, do you think it's acceptable that people are waiting over a week to get test results when they're close contacts?
I think that's very unfortunate. What I can say, though, is that we are processing, while we have had massive surge in testing that slowed down the labs, there are no test results outstanding that have been there for more than 48 hours. And most of those now are being processed within the 24-hour time frame that we aim for. There's a little bit at the margins where they've just been doing that final bit of catch-up, but they should be back, as of today, back to a 24-hour turnaround time. So those results will be reporting back to primary care within 24 hours. Again, if there's a positive test result, people will know about it pretty quick.
Okay, so knowing what we know now about the Crowne Plaza MIQ hotel, why was the Auckland COVID vaccination clinic located directly next to that?
We've canvassed this before. That vaccination clinic was initially set up to provide support for MIQ workers. And so that is where the centre was located. Additional protective measures were put in place to make sure that it was suitable for public vaccination. And I've not seen any evidence at all that the proximity of that vaccination clinic to an MIQ facility in any way increased the risk to the public who were going there for vaccination.
Okay, so information obtained via official information says a total of 1,139 air filtration units have been purchased for MIQ rooms as of the 9th of August. But according to the government, there is over 4,000 rooms available per fortnight. So how many MIQ rooms still do not have portable ventilation systems, given air filtration was identified as a key weakness as early as February of this year?
I make two observations on that. One is that the ventilation assessments that have been done on each individual facility will have identified those that require additional remediation and those that don't. The fact that a facility hasn't had additional filtration units installed in it can in part be because the ventilation assessment may have determined that they did not need that. Recognising that we're dealing with a variety of different physical environments here. And so the ventilation assessments look at the airflows within those facilities and determine whether they need filtration units. The priority for those filtration units has been in the public spaces where the risk of transmission is the greatest, and in the individual private spaces where the air ventilation system created a risk of cross-contamination. So in terms of, so for example, if the air ventilation systems in individual rooms were linked to one another.
Yeah. Minister, but would you be concerned if you knew that procurement agencies knew how many units they required but hadn't articulated that to suppliers?
Look, I'll invite the team who are doing the procurement to comment on that.
Oh, thanks, Minister. So with the ventilation program, as the Minister said, the air filtration units themselves were put into corridors and lifts, and I believe 23 facilities are complete. We're waiting on about 400 or so more individual air filtration units to complete that work, so it's been risk assessed. But through all of the expert assessments, it was never intended that every one of our rooms would have an individual air filtration unit in it. We did put them into the quarantine rooms here in Wellington as an extra precaution, but in general the work has been such that by optimising the ventilation systems of the hotels themselves, we've been able to get the balance of air pressure in each room. We're aiming for just negative air pressure in every one of the rooms, and generally the hotel ventilation system itself, once we remediate it or just fine-tune it, can achieve that.
So Megan, how many more MIQ rooms does the government intend to bring online by the end of this year for the nearly 1 million Kiwis that live abroad, of which many of them will be wanting to come home?
So I think the Minister's already mentioned that we're looking at...
Sorry, I didn't hear a number.
I'm sorry?
I didn't hear him mention a number.
I think at this stage...
Do you mind unmuting?
Sorry, that's my fault. Look, we don't have a number, and I wouldn't share a number at this point. That will in part be determined by commercial negotiations with the facilities that we're talking to.
Oh, okay, so thank you, Simon. We've got a couple of minutes left, so just one final question to Chris Bishop.
Muted myself again, sorry. 210 cases in the community today. Minister, how many of those people are vaccinated?
I don't actually have that number yet. We will know more. There tends to be a bit of a lag in getting that information. The case investigations will provide us that information. It has been asked for. I don't have it, but as soon as I do, we'll make sure we share that, and I'll make sure that the member gets that information.
Okay. Just in relation to something you said before around I think the language you used was the variability of reasons for travel for people to come to New Zealand to use MIQ. One of the things we floated as an idea in opposition is whether or not there should be a points system, a bit like the immigration system for MIQ. Have you received advice on something like that or a similar concept?
We're looking at a whole variety of different things. One is how we would make the Maya system that we use now fairer, more transparent, and a bit more equitable. The other is whether there are alternatives. And so, yes, we're looking at that, and that might include some sort of point system. One of the challenges with that is if you look at the immigration point system, between deciding that you want to apply and actually getting your way through that, you could be waiting 9 months, a year, 2 years, to actually get your application processed. It's an enormous undertaking to process someone through that system where you're verifying them the number of points that they have. So it's a question, I guess, of getting the balance right. If we were going to move to a sort of more of a merit-based system, how would you, as much as possible, with still a relatively light touch assessment process, verify the information that people are providing?
Yeah, I accept the logistical challenges, but you didn't really answer my question. Have you received advice on some sort of point system for MIQ?
We've been in discussions about whether there should be some kind of prioritization process, whether it's points or something else. We've been in discussions about that.
Okay, and just finally on this point, I've got a written question back from you in which you say that you commissioned advice on the expansion of low-risk MIQ facilities to expand the numbers on the 13th of July. Is that the first time? Is it right to say that that's the first time you sought advice on the expansion of low-risk facilities?
No, we've been in conversations about that right the way through, but I do want to point out we weren't actively exploring this during the time when demand was less than supply. So we weren't actively exploring adding extra capacity in when we had rooms sitting empty because people weren't booking them. So we then got a bit of a surge, and as a result, that's when we started to actively explore again how we might bring extra rooms on stream.
Okay, well, thank you. We are at time, so thank you very much, Minister, and thank you to the team from MB and also the Customs Service for being with us today. And we're back again at the same time tomorrow when we'll be hearing from Professor Sir David Skegg and the members of the Strategic COVID-19 Public Health Advisory Group. So thanks for tuning in and thank you for being with us.